All right, so this series of techniques is specifically designed to help someone that has pain more in the lower portion of their neck, potentially some pain down the arm as well. All right, so this is treatment of the thoracic girdle. This includes the manubrium here, like the very top portion of the breastbone or the sternum, as well as some of the upper ribs and the upper bones of the mid-back, okay, so just below the neck. Oftentimes this area becomes stiff and dysfunctional with poor posture, some of the things that we talked about on the last video, and they all need to be addressed, starting with the manubrium, working into the ribs, and then ultimately into those upper bones of the back of the neck. Specifically, people that have a hard time with side bending their head or limited motion or painful motion with rotating their head or even with looking up. Okay, so those are some of the pre-tests that I do before I go through this series of techniques. So the first area that we're interested in treating with the thoracic girdle is the manubrium, which sits right in this area. The collarbones come down, the clavicles come down and forward here, and there is kind of a prominence area here called the SC joint, and just to the inside of the SC joint sits the manubrium, which is at the top of the sternum here. So there's 4 areas that I want to spring just to see which area is the absolute tightest. And really the tightest area is this top right section here. So I am going to then further localize through my fingers, and it feels like the tightest direction is up and out here. So I'm going to hold that down while I now bring her left hand over to her right shoulder, and I will further localize this until it brings a harder end feel into my fingers. And right here, just as I flex up her elbow, it comes into my hand. So now hold here, Keely, don't let me lift your elbow up. And let it go, good. And I'm just providing a little bit of resistance and traction through her arm, which helps to just engage that barrier to help that let go. And I will continue until I didn't feel any additional improvement in that area. So that is mobilization of the manubrium. All right, so whenever I was still in physical therapy school, I had a really great mentor who taught me to mobilize the first rib. And what I found was with some patients it worked really well just to work through the first rib, which I'll show you likely in the next video. But there were tons of patients where I would just jam on that first rib and it would not go anywhere. I then went to some advanced functional manual therapy courses through the Institute of Physical Art, and they started talking about this concept of mobilizing the second rib, mobilizing the third rib. And that's what I'm going to show you right now, because oftentimes it's not just the first rib that is elevated up that can't drop so that that person can then side bend their head and be happy in their neck. It is oftentimes also the ribs below the first rib and even all the way down. Okay, so, but specifically in this video, I want to show you how I access the second and third rib. It's not the most comfortable thing in the world. In general, rib work is not the most comfortable thing in the world. Okay, so I am going to bring her elbow up to the side so that I have access to her armpit. And I warn my patients, this may be ticklish, this may be painful. If you can hopefully bear it until I really sink my hands in, then things tend to be a little bit happier. All right, and Keely's already just like anticipating what this is going to feel like. So I'm going to get onto her armpit here. Now relax your arm down. As she relaxes her arm down, I am sinking up as high as I can go to work to access ribs 2 and 3. And I believe that I'm actually on rib 2 here. And she is loving it. She's just like shoulders trembling underneath my hand. So relax your shoulder blade as much as you can. Very good. There we go. It is hard. So then from here, I am hooking on the top portion of her second rib, And I can have her do different things. Okay, I could have her just breathe, because as she breathes in, that rib is likely to raise up towards her head. And as she breathes out, I'll take up that slack. And again, as she breathes in, I'm kind of pinning that rib down, so that then as she breathes out, I can then localize further, take up the slack. Very good. And out. Good. I can also get more aggressive with this, and I can stay hooked on that rib, have her hand go onto her opposite ear on the other side of her head, hold your head up with that hand. I'll take this pillow out, and I'll help her control this. There we go. And now go ahead and drop down, Keely. And that is a lot more aggressive, probably a lot more painful, but it can be a lot more effective. So come on up, taking up the slack as she goes up, and I'm holding it there as she drops down. And come on back up. And I'm sure all of you out there watching right now really want to come see me after seeing this mobilization. It's not the most comfortable thing in the world, but it can be very effective when it comes to helping people with that lower neck pain. So that is mobilizations of ribs 2, 3, you can mobilize 4, all the way to however low you need to go. Now I'm going to show you how to mobilize the first rib, now that we've mobilized second and third rib from the side. So with the first rib, to get on this, you actually have to kind of peel back the layer of upper trap muscle here, up in the shoulder. So I'll peel that back, and then I can sink on with my thumb onto something hard, which is the first rib. And oftentimes patients are thinking, that's like, I have a rib up that high? And I'm like, yes, you have a rib up that high. Okay, so this is literally the ribs start right where the neck ends. All right, so first thing here, I can localize through her head there. Okay, so I have a hard infill kind of going down that way. And I can just have her breathe to start out with. And out. So this is a functional mobilization just with breathing. All right, if that is not doing it for me, then I can add in hand to the shoulder, localize through the elbow right there. Don't let me lift you up, Keely. Hold and breathe in and out. Good. I can further add to this, hold again, and let it go. I can further add to this by take your knees to the right. There, and that actually loosens it up, which I might like that, but let's see what tightens it up. There, right there, going to the left, tightens it up. So I'm just going to engage the elbow here, hold here, Keely, take your knees to the left, just right there, keep them right there, and just breathe. So now I really have this first rib locked, and if I can increase that infill, oftentimes it'll let go faster. And relax the elbow. Good, and I'll further localize here. Take your knees a little bit further to the left. There you are, hold that, breathe in. Good, as she breathes in, I block it. As she breathes out, I follow that out. All right, so that is mobilization of the first rib. So now we're gonna look at the ability for T1 and T2 to extend and rotate. All right, and just for the purpose of this video, I'm on the right side of her body, and I'm going to see the ability for her T1 and T2 to extend and rotate to the right, meaning the pokey part of the spine needs to be able to go that way. Okay, so there's 3 positions that I want to check this. First, I'll start with just hand behind the lower back, and I'll feel how that tightens up as I bring her arm up into those segments. And it gets pretty tight here at T2. I'm going to bring her into a second position of hand out to the side. And then with this one, I'm going to bring her elbow up, and that's even tighter into T2. I apologize, you can't see where I am. I'll come on the outside here, right there. And then the third position is actually going to be out with the hand behind the head. And I'm bringing her elbow up and feeling how those bones go down and away. And actually the tightest one that I'm going to focus on is right out to the side, more of a pure rotation here. All right, so I'm going to get on that C2 right there. Is that tender, Keely?
Yeah.
So I have that there. Nice, soft hands, and then I have her engage her. Don't let me move you here, Keely. Don't let me pull your elbow out. Good. That engages that T2 right into my thumb. And let it go. Good. And again, hold here. And let it go. And I would keep mobilizing that. That's actually already starting to loosen up. I would keep mobilizing that until it either became very springy or I lost the ability to gain any more motion. Now, Keely, go ahead and go up onto your elbows. I'm going to bring the camera up a little bit here. Very good. And now what I want you to do is bring this left hand to your right shoulder. Let your forehead relax into the crease of your elbow. So now I have her here. She's relaxed into my arm. I have my feet nice and wide. Now I can also get into a little bit more relative extension or backward bending here to get now back onto that T2. Although now T1 is the tighter one in this position. And now, Keely, you can press your elbow down into my arm right there, and that engages right into my thumb up here. And let it go. Good, and I'm further localizing here, tractioning her body, her arm away from her pelvis. Hold here, don't let me lift you up. Good, and let's say that I have all that I'm gonna get there and let it go. Now I can really challenge the re-education component, which I haven't shown you in any of the other videos. But Keely, I want you to press hard through your right elbow here. Reach long through your left elbow. Good, and hold yourself here. Good. I'm taking away my help. She's working hard. She's really shaking. Very good. Keep holding. That's really challenging the stability of her right shoulder blade, but also some of her lower middle trapezius here. Don't let me move you. Good. I'm tractioning through her elbow. Good. And generally, I'll then have her lower down and come back up, but she's really tired. Relax there. So I am going to give her a break. Very good. She didn't know that we were doing that part of the video. That was just a little improv by her husband that loves her so much. Okay, so you can relax down. That is extension and rotation of T1 and T2. So that is treatment of manubrium, first, second, third ribs, as well as T1, T2 of the upper back. I would then get my patient back up and see, did I make any difference? There's all kinds of assessments that I would do, but oftentimes they would include some amount of rotation, some amount of side bending. Keely didn't have a specific dysfunction this time that I could reassess for her, but just so you have some idea, that's what I would reassess to see if this helped her neck pain, her total amount of motion, or her quality of motion.